COVID-19 variant poses a threat to humanity. The latest form of the COVID virus is causing outbreaks in major cities around the world, including New York City. The mortality rate of the COVID-19 Delta variant is substantially higher than that of the original COVID-19 virus. It is critical that everyone get vaccinated as soon as possible to protect themselves and their family from this terrible illness. The COVID-19 Delta variant virus is a newly discovered virus in the United States. This virus has spread swiftly and might be lethal to humans if not addressed. COVID-19 Delta variant symptoms include difficulty breathing and low oxygen levels. This new strain is so contagious that it may pass via mucosal membranes like the mouth and nose, as well as through the skin. COVID-19 Delta variant poses a serious threat. There are no therapies or preventative measures known at this time, and the disease has spread to at least 5 countries. COVID-19 Delta variant has been exposed to 500 million people around the world, with forecasts putting that figure at 900 million by the end of the year. COVID-19 Delta variant, a novel Ebola strain, has been discovered in Congo. Because the disease is carried through bodily fluids, there is a high potential of transmission. 3 individuals have already died as a result of the epidemic, and the virus may kill you in as little as 6 days. COVID-19 Delta variant is a lethal and highly contagious virus that was initially discovered in the late 2020s. The virus still has pandemic potential, and the only way to protect yourself is to use an experimental vaccine created in 2032. While the consequences of COVID-19 Delta variant are unknown, it is obvious that it will result in a global pandemic. It's vital to keep in mind that this new strain is extremely contagious and can kill in as little as 2 hours. Outside of the lab, however, no cases of infection have been detected. COVID-19 Delta variant, an antibiotic-resistant bacteria, has recently emerged as a major threat to global health. COVID-19 Delta variant has generated a public health disaster that is expected to kill 300 million people globally by the year 2100 due to a shortage of new antibiotics being developed to tackle the disease. Prevention is the only approach to combat this condition. COVID-19 is a virus that has infected the entire world's population. It has recently evolved into a more deadly variety, as the symptoms are more severe and there are more instances. There are numerous differences between the C19 versions. Because they are more lethal, they are also driving a rise in death rates. The most frequent virus strain, COVID-19, has been seen the most in recent outbreaks. It's dangerous because it's resistant to a lot of antiviral drugs. COVID-19 isn't new in and of itself, but it has progressed. The ability of COVID-19 to mutate and establish genetic escape pathways contributes to its antiviral resistance. COVID-19 is a relatively new virus that has made headlines in recent months. It produces respiratory symptoms and is transferred by coughing or sneezing droplets. The ability of COVID-19 to mutate and establish genetic escape pathways contributes to its antiviral resistance. The most crucial thing you can do to protect yourself from Delta, according to physicians, is to get completely vaccinated. That means that if you get a 2-dose vaccine like Pfizer or Moderna, you must get both doses and wait the necessary 2 weeks for them to fully take action. It is crucial to follow the CDC preventative instructions, which are available online, whether or not you are immunized. Individuals with weakened immune systems should avoid crowds, especially indoor crowds, and practice social distancing. All of that still applies to these really vulnerable people. Even better, a research discovered that after both doses, the Pfizer vaccine prevented 90% of illnesses even when new variants were prevalent in the population. People are less prone to spread the virus to those around them if there are fewer illnesses. Finally, to protect themselves and their loved ones from the Delta variety, people must take safeguards. You're practically inviting Delta problems if you haven't had COVID, aren't vaccinated, and aren't wearing a mask. It is going to find you. The virus in this form is by far the most effective at finding hosts. A mask is necessary right now if you haven't been immunized. When spending time with people from different houses, you should wear a mask over your nose and mouth, especially if the place is poorly ventilated or congested. Keeping a 6-foot distance from strangers. Hand washing on a regular basis, or using hand sanitizer when soap and water are unavailable. Avoiding crowded interior spaces, especially those with little ventilation. Keeping an eye on local COVID-19 infection rates, including the Delta form, and avoiding needless social contact with others when infection rates rise. I invest a lot of time and effort into our program, and we're grateful for all of the likes, comments, and messages I received. Thank you for taking the time to watch my video and for your continued support. Please do subscribe to my channel, and we'll give 110% effort to improve more.